Ozempic is everywhere right now. It went from a diabetes medication that most people had never heard of to a cultural phenomenon in what felt like about 18 months. Celebrities started losing weight noticeably fast. Social media filled up with before and after videos. Doctors started getting calls from patients who did not have diabetes but wanted a prescription anyway. And now millions of people are either taking it for weight loss, thinking about taking it, or wondering whether they should. The conversation around Ozempic in popular culture has been almost entirely focused on one thing. Does it work? And the answer to that specific question is yes, it does. People lose significant amounts of weight on it, but that is about a quarter of the actual story, and the parts that are getting less attention are the ones that matter most if you are seriously considering using this drug without a diabetes diagnosis. We are going through all of it today. What Ozempic actually is and how it works in the body, what the FDA has actually approved it for, what the research shows about weight regain after stopping it, and the side effect profile that the celebrity endorsements conveniently leave out. Stay with me because the weight regain data is the piece that almost nobody is talking about, and it fundamentally changes the calculus on whether this makes sense as a long-term strategy. Let us start with what Ozempic actually is, because a lot of people have heard the name without understanding the mechanism. Ozempic belongs to a class of drugs called GLP-1 receptor agonists. GLP-1 stands for glucagon-like peptide 1, which is a hormone that the body naturally produces in response to eating. When you take Ozempic, it activates GLP-1 receptors in the pancreas, which increases insulin release and reduces glucagon release. Insulin brings blood sugar down, glucagon raises it. So the net effect is lower blood glucose levels, which is why the drug was developed for people with type 2 diabetes. But GLP-1 receptors are not only in the pancreas, they are also present in the digestive system and the brain. When Ozempic activates those receptors, it slows down how quickly the stomach empties food into the small intestine. That slower gastric emptying keeps people feeling full for longer. Combined with a reduced appetite signal in the brain, the result is that people eat significantly less without necessarily trying to. That is the weight loss mechanism. It is not magic. It is appetite suppression through a pharmaceutical pathway. People lose weight because they are consuming fewer calories than before. This is also why Ozempic was originally designed to offset the weight gain that commonly comes with other diabetes medications. Managing blood sugar while preventing medication-related weight gain was the core use case. The drug was approved by the FDA in 2017, specifically for adults with type 2 diabetes, to help manage blood sugar alongside diet and exercise. That is the approved indication. Managing blood sugar in diabetic patients. Ozempic is not FDA approved for weight loss. It is not FDA approved for people without diabetes. Using it for those purposes is what is called off-label use, which means a doctor can prescribe it, but the FDA has not formally evaluated it for those applications. There is a separate drug called Wegovy, which uses a higher dose of the same active ingredient, semaglutide, and which is specifically approved for weight management in people with a BMI over 30 who also have at least one weight-related health condition like high blood pressure. If a doctor is prescribing Ozempic specifically for weight loss in someone without diabetes, they are prescribing it outside its approved use. Now here is the part of the story that the before and after videos do not include. What happens when you stop taking it? A study tracked participants with overweight and obesity through 68 weeks of weekly semaglutide injections alongside lifestyle interventions. The weight loss during that period was substantial. Then the researchers took participants off the drug and stopped the lifestyle interventions. Within the first year after stopping, most participants regained approximately 2/3 of the weight they had lost. Blood pressure, cholesterol levels, and other health markers also returned to roughly where they were before the drug. The study authors concluded that to maintain the benefits, people would need to stay on the drug indefinitely. Think about what that means practically. Ozempic is not a treatment that addresses the underlying drivers of weight gain and then allows you to maintain the results independently. It is a continuous intervention. The weight loss exists as long as you keep taking the drug. When you stop, the hunger suppression stops and the weight returns. That is a very different proposition from what most of the cultural conversation implies. And the drug costs hundreds to over $1,000 per month, depending on insurance coverage. The safety profile is the other dimension that needs honest attention. Ozempic's known side effects range from common and manageable to serious and significant. The most frequently reported are nausea, vomiting, diarrhea, abdominal pain, and constipation. For many people starting the drug, these are significant enough to affect daily functioning, though they often improve over time as the body adjusts. The serious side effects are less common but more consequential. The FDA labeling for Ozempic includes warnings about possible thyroid tumors and cancer, pancreatitis, vision changes, low blood sugar, kidney problems, and gallbladder issues. These are not theoretical concerns invented by critics of the drug. They are listed by the manufacturer and reflected in the FDA's own labeling requirements. The long-term safety picture is genuinely unknown. The drug was only approved in 2017. 8 years of use in a relatively small population of mostly diabetic patients is not enough to know what happens with decades of continuous use in a much larger and more diverse population of people taking it primarily for weight management. That uncertainty is not a reason to dismiss the drug, but it is a reason to be honest that nobody can currently tell you with confidence what the 20-year safety profile looks like. There is also a question that almost never gets asked in the popular conversation about Ozempic. Who is this actually appropriate for? Nina Crowley, a registered dietitian with expertise in this area, draws an important distinction. There is a meaningful difference between someone who wants to lose a few pounds and someone managing the chronic disease of obesity, which is defined as a BMI over 30 and comes with compounding health risks. For people in the second category, the risk-benefit analysis of a medication looks very different than it does for someone who simply wants to be thinner. A conversation with a healthcare provider who understands that distinction is the right starting point, not a social media video or a celebrity interview. What the evidence does support is that for people with type 2 diabetes who are managing blood sugar and trying to prevent major cardiovascular events, Ozempic has a documented and meaningful benefit. The Ozempic clinical data shows reduced risk of stroke, heart attack, and cardiovascular death in adults with type 2 diabetes and known heart disease. That is a real outcome for people in a specific medical situation. It is not the same as being an appropriate weight loss tool for the general population. The bottom line from the dietitians and healthcare providers who have looked at this carefully is consistent. If you have diabetes and your doctor recommends Ozempic as part of your treatment plan, having a clear understanding of the side effects and the monitoring involved is important. If you do not have diabetes and you are interested in this drug for weight loss, the conversation with your doctor needs to include what the approved alternative looks like, what the weight regain data shows about long-term use, what the side effects are, and what monitoring you would need, and whether your situation meets the clinical threshold where the benefits genuinely outweigh the risks. Following the lead of celebrities and influencers on a prescription medication decision is not a framework that serves your health. There are research-backed approaches to weight management and metabolic health that do not require weekly injections, do not cost thousands of dollars per year, and do not come with an unknown long-term safety profile. They are less dramatic. They do not make for compelling social media content, but they are available to everyone, and the benefits do not disappear when you stop. If you want more honest breakdowns of health topics that are getting oversimplified online, subscribing to this channel is the best way to stay connected to that content.